Chairperson, Mr. Diva Pantia, the Director General of the Open University of Mauritius, Dr. Sikun, the representative of the Ministry of Education, distinguished guests, dear parents, the postgraduate and the MPH student of the Open University of Mauritius, member of the press, ladies and gentlemen, all protocol observed. I will not introduce myself again because the moderator did it, but what I will add on what she did, you will really see how I am excited for being here to this graduation ceremony for two things. First of all, because the people, most of them who will be graduated today are from MPH, Masters in Public Health. I did also that one many years ago. I will not forget methodological, but it's my pleasure really to be with you for your graduation as someone who is holding this degree. Second, because I am a former dean of the School of Medicine and Public Health in my country. So I used to be in this kind of ceremony every year, but since I became the representative or the staff of WHO, I'm just coming when I am invited. So here in Mauritius, it's the second time. The first time I was invited by the University of Technology. Now it is my pleasure to be invited by the Open University of Mauritius. Thank you very much for inviting me. So dear postgraduate students, learners, and the MPH student of the Open University of Mauritius, today is your day. Because you'll not be graduated twice for the MPH or another degree. Today is your day, so you have to be happy of that. And I am convinced that you have already been equipped with all need to know to face the next stage of your life. So today I have chosen to share with you a bit about some reality on the new life that you are going to start very soon. Particularly, some lessons that I picked are related to leadership, and I think leadership is in all of you, and I'll talk a bit about public health. Starting by leadership. A good leaders are continually learning. Don't think that you have now your degree, you finish everything, and you will not need to continue to learn. No. A leader are always interested to know what a recent publication are, always trying to develop a new skills. Don't think that you have achieved. You need to continue to learn more and more, especially on the best practice. Of course, if I talk about best practice, they are all based on the scientific evidence. As DG said, you can analyze now the data and provide the best practice that your country can use. A good leader are service-oriented. Life is not a mission. Life is a mission, it's not a career. You will now start your mission. You have to develop a sense of contribution on what you are doing. At least community can talk about you in a positive sense, not in the negative sense, please. They can say Mr. or Mrs. contributed to save lives or of the population, to give us orientation on the weather, to prevent non-communicable disease in your respective village, and to build capacity of the following generation. So you must contribute to something of your life in the positive way. This is a good leader. A good leader exercises self-renewal. They work to develop the physical, mental, emotional, and spiritual skills. And you know that this is the definition of health. And to apply this, you must apply it on yourself first before applying this to others. So you have to give examples. By exercising those aspects on your life, then you will develop a strong and healthy personality and discipline. The medical service requires a discipline and availability of your patient. Ladies and gentlemen, so now all of you from the master MPH and from the meteorology and the meteorological technician, I will quote Stephen Covey in his book of Principle-Centered Leaders, where he said, "Give a man a fish and you feed him for a day. Teach him how to fish and you feed him for a lifetime." I think we can say now, you know how to fish. And your parent, your teacher as well, present here, will not give you a fish day to day. As it is used to be, you are going to fish yourself for the lifetime. Ladies and gentlemen, let me talk a bit about public health. And I will not elaborate more because I already talked a lot about the leadership and I think it's the most important things. But for the public health, patient will expect many things from you, including what you can't not be to do. When a patient is coming to a medical doctor, he is expecting everything, even what he is not able to do. So try to do what you can, but patients need confidentiality. Confidentiality is one of the most important pillars of medicine. Protecting the private detail of a patient is not just a matter of moral respect. It is essential in retaining the important bond of trust between the health workers and the patient. The confidentiality of patient health information is the top priority, not only for the patient, but for their family, the health providers, professionals, even the government. If you are making that confidentiality, you are helping also the government. Ladies and gentlemen, in Mauritius, before coming here, the chairperson asked me the most problem of health in Mauritius, and I am happy that I prepared something on that to sensitize you to help your country. In Mauritius, non-communicable diseases are the leading cause of death, disease, and disability. And the fourth major NCD are diabetes, cardiovascular disease, cancer, and respiratory diseases. And those account in nearly 81% of all deaths. All 81% of deaths in Mauritius are due to non-communicable disease. And 85% of disease burden, putting increasing strain on health system, economic development, and the well-being of all the subgroups of the population. So as a new generation, you are a new generation, graduated, you must contribute strongly in promoting intervention to reduce the NCD risk factor and by strengthening health system to address non-communicable disease. I am optimistic about your ability to succeed in the prevention and control of an NCD in your country. Because now you know what to do. If I'm wrong, tell me no. You know how to do it, and you know where action must be taken, especially those who are graduated for public health. You know very well how primary health care is important. And those who are graduated from meteorological, you know how we need it to plan our day and our week. This is really very important. So, and you can't do that alone. It's not possible. You will need to work with others, with your senior and other in integrated and coordinated approach. Don't think that you can succeed alone. Work together in an integrated and coordinated manner. Ladies and gentlemen, before ending my speech, allow me on behalf of all of you, because I'm the guest honor, to congratulate your parent present here, to congratulate your teacher, to congratulate the Open University of Mauritius and Imperial College and your government. Why to congratulate them? Because they contributed on your scholarship that allow you to be graduated today, to be what you are today, and because by choosing to put you here, today you all have been placed in a position of advantage amongst your peers due to the knowledge you have had. Congratulations to all of you. Once again, from now, you will be the ambassador of the Open University of Mauritius across your country and abroad, and especially those who are I think you are the first cohort. Yes. You are the first cohort. So you see now how you must be the ambassadors of your school, in your country, and abroad, and you must play a big role for advocacy. Once again, have a nice day, and thank you very much for your attention.